Hello out there in television land. I'm with man's best friend.
Me?
I don't... Yes, you.
Okay.
And welcome to another edition of It's Your Health, the spring version. And we're here with our new addition, Donny. We'll tell you all about him a little bit later on.
Donny Bay.
Donny Bay, yes. The fact that his hair is orange and goes back, people said, well, I named him after Donald Trump, but that's fake news, by the way, fake news.
Well, I would certainly hope so.
But again, welcome to It's Your Health, and I'm here with my bride to bring you the latest and greatest in healthcare information. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Remember, it's Your Health, your leader in healthcare and pet information. We'll be right back. Welcome back to the first segment of It's Your Health. Maybe you want to tell our viewers out there in television land a little bit about Donny.
Well, maybe before we do that, you should tell them the disclaimer.
Oh, make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health.
That's the one.
That's why I bring her.
This is Donny, and he's making his way looking around at everything. He is a 4-month-old golden doodle from down in the Reading area, and he's adjusting to life with us.
That's right. I'm the good cop, she's the bad cop.
He feeds him, I don't.
But moving right along, shall we start our show?
Shall we start with some headlines?
Please do.
Okay. A diet rich in mushrooms if you want to avoid dementia. Regular consumption of mushrooms may reduce or delay development of age-related neurodegeneration. Who thought?
Isn't that great? Well, I think it's part of that, getting back to our roots as cavemen, grains and vegetables sort of diet. But be careful out there if you're picking your own mushrooms. I recall a case of a woman down in Shenandoah who gathered all her mushrooms together and processed them, ate them, and shortly developed liver failure and died because there was a poison mushroom amongst the carpet of things.
Ooh.
So if you're out there picking your own, be very careful. You need to know what you're doing. But nevertheless, mushrooms, I think, great food. So
Great fungus.
yes, absolutely.
Next headline, association between direct-to-consumer advertising and testosterone initiation. Testosterone initiation increased substantially in the United States from 2000 to 2013, especially among men without clear indications. So did direct-to-consumer advertising.
Well, who'd have thought? Normally we would not see a patient unless they were having symptoms that we could link to low testosterone. But of course, when it's on television during sports events, men will come into us and say, hey, you want to test me for low T? And in some patients it was low, although they had no symptoms referable to it. But nevertheless, the idea that drug companies kind of went ahead of anyone else and directly advertised the fruits of their medications kind of brings it more to the forefront. Now, that being said, it did bring the awareness of the situation to us as well, because a lot of guys aren't going to come in and say, I need some lead for my pencil. So this type of direct advertising may have brought it a little bit more to the forefront. So it's a two-edged sword.
Gotcha. Next headline, cardiovascular risks of testosterone use among men. Oh, okay. Testosterone therapy is associated with increased risk of serious cardiovascular events.
Yeah, well, when you put on a hormone into a person that they may not need or did not have, it's fraught with danger. On one side of the coin, if you recall, women, we used to put them on post-menopausal estrogen replacement. That's kind of gone by the wayside because of the side effects. Same thing with male menopause. The addition of testosterone may have some side effects to it. But quite frankly, we haven't seen them, to be honest with you. We haven't seen the tremendous type of concerns that were out there with the testosterone replacement. Again, it's not for everyone. It has to be followed. It is not without risks. It can lead to serious consequences, as with any treatment.
Gotcha. So we have to be careful. I don't even want to do the next one. It's so creepy crawly.
That's why we don't go anywhere.
This is why.
This is why.
Bed bugs, helping your patient through an infestation. They've been unwelcome bedfellows for thousands of years. With increases in population density, ease of travel, and insecticide resistance, bed bugs have reemerged big time.
Yeah, it is. When we did travel, I know that you'd be the first one to go through the bedding and look for bed bugs and eggs and things like that.
You can look along the seam and you can find their fecal matter. And if you see that, pack up.
Yeah, for sure.
And speaking of packing up, you don't put your suitcase on the bed and you don't put your suitcase on the floor. You put it on the holder for the suitcase and keep it away from everything else. That's another way to keep safe.
Good advice. And of course, once you bring these things home and have an infestation, that's a real problem. Unfortunately, there's no real treatment for the infestation once you have it, except for symptomatic care. Maybe antihistamines, maybe some cortisone products. You have to watch you don't get a secondary infection. I think the bigger problem is if you bring them home, you are going to have a tough time getting rid of them.
Well, you probably need professionals to do the job, and it's not cheap.
Right. So maybe you should just have a staycation like we do.
Oh, we have a lot of those. Throughout the mid-20th century, 30% of U.S. households were infested with bed bugs. 30%.
And get a load of this full screen. It lists the top 10 places where you're going to find these things in case you're traveling. So
yeah, there's Philadelphia and New York. Wow, right by us.
We'll show some pictures of what an infestation looks like on the legs.
Oh, good. I won't look at that.
Okay. Close your eyes.
Okay. Let's go to something related to drugs.
Okay.
What drugs work best for diabetic nerve pain? Nerve pain and numbness, also known as neuropathy, is a debilitating but common symptom of diabetes. New research suggests certain drugs may outperform others in treating diabetic neuropathy.
Well, keeping your sugar under control first may help forestay neuropathic pain. Worse at night, feels like there's knives going in your legs. Hard to treat, but we've had some luck with two drugs that maybe you haven't thought about there. Cymbalta and Effexor. These things can often help to cut down on the pain. We have used Lyrica and Neurontin in the past. I'm not terribly impressed by that, by the way. Obviously, you want to stay away from narcotic use because this is a chronic problem. But you may want to consider Cymbalta, Effexor, not at the same time. They're two different antidepressants that will help with neuropathic diabetic pain. Speaking of the fastest half hour in television history.
We didn't get to the next headline?
We'll have to save it for
It's the most important one.
And what's it called?
The health benefits of being in a happy marriage.
Oh, are there? We'll have to save that for the next segment. We'll be right back after this
Very
brief
funny.
commercial message. Remember, you're watching It's Your Health, your leader in healthcare information and pet therapy. I'll be right back.
Welcome back to It's Your Health. Our stage has been stolen by our visitor.
Yeah, they say in television not to deal with pets and children, but he's stealing the show so far.
He is, and we're going to start not with the headline like we always do, but with finishing the last one from the first segment.
Alrighty.
The health benefits of being in a happy marriage. Finding love, then sticking with your sweetheart may benefit your health in more ways than one. Married couples had lower levels of the stress hormone cortisol. So there.
Happy marriage, I think, is the key.
Would you like to explain the...
We will expand on that. And you'll look at your screen, you'll see the 7 health benefits, which we'll briefly go over. You're going to be less likely to die of cancer. That's unbelievable. You may be better protected from heart disease and stroke. You may age more happily. You may live longer. And you may go through surgery a lot better. Isn't that interesting? And you may enjoy longer overall lasting health.
That's because you have a partner.
Yes.
Somebody who keeps you happy.
Yes.
Just like you. Just keep me happy.
Yes. That's a full-time job.
You heard him say yes. Okay, you ready for a headline?
Finally,
Try
yes.
to work your way out of this mess
Let's
you made?
go.
Okay. Isn't it just annoying when you're fast asleep and you're having a good night and all of a sudden you have to get up and go to the bathroom? That's really distracting. Less salt, fewer nighttime bathroom trips. Lowering your salt intake could mean fewer trips to the bathroom in the middle of the night. People over the age of 60 and even younger wake up to pee 1 or more times a night. This can lead to stress, irritability, or tiredness, affecting the quality of life.
Yeah, no doubt. Salt is really becoming a poison, so I would really throw your salt shakers away. If you use sodium products, which is everywhere, pickles, ketchup, and the obvious ones, potato chips and snacks, retains fluid that you're going to get rid of at night. And as an aside, when I wake up at 2 in the morning and reach out and I felt this hairy leg, and I thought it was yours, but it was his. I said, maybe she should shave, but it was Donny's. I'm sorry, he was sleeping with us, so.
That has nothing to do with anything.
Oh, okay, it just somehow came into my head.
I'll bet it did.
All right.
All right, headline. Diabetes, does alcohol and tobacco use increase my risk? Drinking moderate amounts of alcohol may actually lower the diabetes. The opposite of true for people who drink greater amounts of alcohol.
Yeah, that's true. How do you define moderate? No more than maybe 2 drinks a night, and I'm talking smaller drinks.
It's 1 drink for women of all ages and men older than 65.
Huh.
And 2 drinks for men age 65 and younger.
Well, I'm younger, so.
You just slid right in there.
Just slid right in.
Right under the wire.
No more chata for you, right?
And if you smoke more than 20 cigarettes a day, you have double the chance of developing diabetes. I can't imagine smoking 20 cigarettes a day.
Yeah, and what's interesting is people have cut down on using cigarettes, but they've gone into more of the chewing tobacco kind of thing, which increases your oral cancer risk, believe it or not. So changing tobacco products doesn't really, there's no benefit.
Okay, we need you to explain this one. These are 15 cancer symptoms that men ignore. One of the best ways to fight cancer is to catch it in the early stages when it's more treatable. The warning signs for many kinds of cancers can seem pretty mild. So how about if you go through them for us?
And it's not uncommon where we have women dragging their spouse in because guys just don't complain or they neglect. Or
They don't complain?
They don't complain and they deny. They
don't complain medically, let's say.
Let's go to this full screen. Take a look at this quickly. These are things that you need to bring to your healthcare professional. If you have problems when you pee, if you have changes in your testicles, like a lump, if you see blood in your urine or your stool, skin changes, like the color of a mole that may change color or get large or bleed, changes in lymph glands. These are these things that drain our body's fluids in your neck and in your groin, under your arm. If they're enlarged, they need to be followed up. Trouble swallowing. People with reflux, for example, can get a Barrett's esophagus, pre-malignant condition. And of course, those people often have heartburn. So heartburn, trouble swallowing is a concern. Mouth changes. Again, we talked about smokeless tobacco. and you want to watch out for any red or white patches within your mouth or lips, get a dental exam. They often will take a look at your mouth and take a look. If you're losing weight for no reason, that's a big concern. If you have recurrent fevers, no reason. Feel your breasts, believe it or not. And we think of breast cancer in women only, but 1% of breast cancers are found in males. So if you have breast changes, bring that to our attention. Chronic fatigue, a persistent cough, especially if you cough up some blood, we're concerned about that. And if you have pain that is unremitting or you have bone pain, there may be a reason for that. And last, belly pain and depression. Again, these are subtle symptoms. Bring them to the attention of your healthcare provider. Belly pain and depression, believe it or not, if this was an exam, we would circle pancreatic cancer as a concern. So
really?
Yep, it's an odd one, but that's where it's at.
Wow. Well, now while you're on a roll explaining everything, how about if you explain this to me? This is called low back tracts, portable spinal traction.
We're going to put this up on the website. I love our patients because they continue to educate us. I had a patient of mine who had chronic back pain, disc disease, arthritis, nothing helped. And she found this low back tracts, which was a rather inexpensive tool. It's almost looks like a thing you'd see on a bicycle, the handlebars, and you put it between your legs and pull up on your thighs. You may want to research it, check with your doctor first though, and her pain went away. Her pain went away.
Low back tracts.
Right. Check on this full screen and it will have the website there. I think she bought it on QVC or one of these kind of things. So speaking of things going away, we have to go away again for this next commercial segment. Remember, you're watching It's Your Health. We're your leader in healthcare information. Me, my bride, and Donny. We'll be right back.
We'll be right back. And Donny is enjoying the show, every minute of it.
It reminds me of those old hee-haw. Those that remember hee-haw, they'd have these dogs laying around and playing.
Boy.
It doesn't jog your memory there.
I remember.
Okay.
Before we start with the headlines, we'll finish with something from the last segment, okay? Not that I need your permission, but I just thought I'd be nice and ask.
Geez, it's the first time ever.
You mark that down. I seem to get a cold every spring and fall. I'm wondering if these are colds or seasonal allergies. How can I tell?
Yeah, that's a good question. And if you check your screen, you're going to try to find out what's the difference between the two. And of course, this spring, we're going to see a lot of allergies and a lot of viral and cold-like symptoms. Whether it's a cold or an allergy, colds will have a cough, and colds will usually have sneezing, a sore throat, runny nose, stuffy nose, not fever. Allergies will have similar symptoms, but usually you're going to have itchy eyes, sneezing, runny nose, stuffy nose. Again, no fever with allergies. And it's really hard sometimes to tease that out. Usually the way I look at it is if you're blowing yucky stuff out, then that's an infection. If you're blowing clear stuff out, that could be either viral or allergies. So
yucky stuff, is that one of the terms that you learn in medical school?
Yes, green or pussy kind of yucky stuff.
Yucky stuff, okay. Well, watch out for that yucky stuff. Headline, Osteoporosis Screening Among Women. It's recommended that universal osteoporosis screening among women age 65 plus and targeted screening of younger women, but historically this has not been done.
No, everybody's concerned about stroke, heart attack, cancer screening. If you add all of those diseases up, they are dwarfed by the chance of you having osteoporosis for postmenopausal women. And osteoporosis is preventable. The consequences are horrible: fractured hip, fractured spine. So if you're out there in television land and you're getting your mammogram, you should be thinking about getting a DEXA scan, D-E-X-A scan. It's an x-ray of your hips and your spine. It'll tell us how thin your bones are so we can be more proactive and treat and prevent further bone loss. Once the bone is gone, we can't get it. Medicare pays for a DEXA scan every 2 years.
Sounds good.
Yep.
Sleep can affect male fertility. The sweet spot appears to be 7 to 8 hours of sleep a night. Sleeping too little or too much can affect a man's ability to impregnate his partner.
Do I have to worry about this? I think it goes without saying that you need adequate sleep for a variety of reasons. This is just one more.
Okay, good way to get around that one.
Yep.
Statin use increase the risk of herpes zoster. First of all, statin is what?
A statin is a medicine that reduces cholesterol, like Lipitor, Zocor, Simvastatin, those drugs.
Exposure to statins can significantly increase the odds of developing herpes zoster, which I don't know what that is.
Shingles.
Oh.
And you know, I was shocked when I read this because I'm a big statin person. I like statins. I like to lower the risk of stroke and heart attack by lowering your cholesterol. A lot of other good side effects. This is the first time I've seen something really kind of eyebrow raising, that the use of a statin can increase your chance of getting shingles. But what that also illustrates is maybe you should go out there and get the shingles vaccination.
But that doesn't give you a 100% guarantee either.
No, it doesn't, but better than nothing.
My sister got shingles.
Yeah, and
she had the vaccine.
Really? Mm-hmm. Well, that's too bad.
Yeah, it is. It happens, though. Maybe they get it not as bad.
Perhaps. I don't know.
Okay, let's change the subject.
Okay.
Breakfast and weight loss. You know I'm not a breakfast eater. And there's been talk forever about it. You have to have a good breakfast to have a good day. Is that really true?
You understand why she's not a breakfast eater. First of all, she doesn't cook, and I'm not home in the morning, so the case closed. But what this goes to tell us is that everyone used to say you have to start the day with a healthy, big breakfast. And it turns out people who never did that and started doing it did one thing and they gained weight, because apparently whatever habit you're in, you ought to just stick with it. And increasing your calories will only increase your weight. So there was no advantage to having people who didn't eat a big breakfast start eating a big breakfast. So.
Gotcha.
All righty.
Not that I want to even talk to you now.
Was that right?
That's right.
You do have great suppers, let's face it.
I do. I do have great dinners.
There you go.
What I put up with. Thyroid disease. Can it affect a person's mood? Thyroid disease can affect your mood, primarily causing either anxiety or depression. The more severe the thyroid disease, the more severe the mood changes. You want to talk about which way?
We see a lot of thyroid out there in television land, a lot of times in women. It does run in families. I think it should be part of a health care exam and screening. Our bride had some thyroid issues, and so she's fine now.
I'm thyroid free.
Yes. So again, it can affect a whole variety of things. The thyroid gland sits in your neck. Think of it as your battery. And when that is low or high, bad things can happen. So easily screened with the blood test. So check it out.
Okay. PPI, what to monitor with long-term use? I don't know what a PPI is.
A PPI is a proton pump inhibitor, Protonix, omeprazole, medicines that reduce acid in your stomach, used for GERD, things like that, heartburn.
It suggests to consider testing for an acid-related disorder in this situation.
Well, if you're getting heartburn and reflux, again, as we mentioned earlier, you may want to get a scope to define the anatomy, make sure you don't have anything bad there. And people love these proton pump inhibitors. And they're okay for short-term use. We're finding problems with them long-term use. You get vitamin deficiencies, you can get thinning of the bone, osteoporosis, gastric polyps, not for the long run. And so you got to be careful with these proton pump inhibitors, monitoring your vitamin B levels, for example, things along those lines. So you got to be careful.
Okay, and we have to be careful because we're at the end of our show.
Already, this is the fastest 30 minutes in television land. Thank you for allowing us to come into your home, hopefully inform you and entertain you, right?
Yeah. Oh, yes. Boy, did we entertain today, I'll tell you. And there's stuff we have to save for next time because we didn't get to it this time.
All right, well, you're just going to have to keep watching Samsung Productions, Channel 13.
Donnie took up too much time.
We'll have to see how much Donny grows within the next couple of weeks or months.
Yeah, that's for sure.
Again, thank you, and it's been a pleasure to be with you today on It's Your Health. We're your leader in healthcare information. See you around, and happy Easter.